New this morning, one of the largest hospitals in our area wants to hear from you. There's a new effort and campaign underway at Jackson Hospital. WSFA 12 News reporter Bethany Davis is live in our studio with Jackson Hospital representatives this morning. Bethany, how is the hospital working to connect with the community?
So Jackson Hospital is in the process of putting several new initiatives in place and reviving some ideas that have worked in the past. It's part of its process of restructuring the way it serves this community. This is Gina Anderson, who's the Chief Operating Officer and Chief Nursing Officer, Jackson Hospital and Clinic. So you've launched this new Stronger Together initiative that you actually launched it earlier this month. Explain what that is and what we'll see as part of that.
Yeah, so the Stronger Together initiative is a community-oriented initiative where we bring subject matter experts from the community and the hospital that know about resources and healthcare needs in our community. And the idea is to bring that network together so we can build a more advanced programs that help the healthcare in our community and have a more robust healthcare ecosystem.
That's a new initiative. You're also reviving some old ideas, like I said, like the Walk with a Doc program, which is actually a pretty neat experience. Explain how that works.
Yeah, so we have a physician we identify on the fourth Friday of every month, and they come to gather together at the water park and walk around with the residents a certain amount of miles. And it gives them a time to ask general questions about their health care, but then access to care and, hey, I have this going on, what do you advise that I do? It's not in-depth questions, but it also helps them to become familiar with what's available to them in our healthcare system.
What a great way to a relaxed setting. So it's not that clinical setting. You're
Lots
outdoors, you're getting a little activity.
Yes.
And it's probably a little bit easier way to exchange some information.
It's more comfortable. Seeing a doctor in that setting really allows the residents to feel more comfortable to ask questions. And then sometimes they'll ask questions that others normally wouldn't, and they can hear that answer as well. So it's very helpful.
Yeah, I also understand that Jackson Hospital is starting a podcast soon.
Yes, yes. We understand that some of our consumers, our patients, can understand better with a podcast and open up a world of information to them that they may not get at other places. And so this will allow us to have our specialties and doctors offer information that they would not normally know or have access to, and to answer questions from the patients. Again, another environment that they feel more comfortable having a conversation about.
Yeah, because that is a new, very popular way to get information about things. We talked earlier this morning about the health needs assessment, which Jackson Hospital is doing right now, and that is also a very important way of involving the community as it continues this restructuring process to build a better relationship, Jasmine, with the community that it serves.
All right, Bethany, and we'll get a link with more on the plans for the future on our website, WSFA.com.